Hi, Dr. Sarush here, inspiring patient story. I want to tell you about how I got into treating a lot of pregnant patients actually from the beginning of my career. It just happened and it kind of fell into my lap. So when I got my first associateship position at a chiropractic clinic, actually a multidisciplinary clinic, the owner, chiropractor that hired me, within 6 months of practice went on maternity leave herself. And she specialized in a lot of pregnancy care and had a lot of pregnant patients. So I was the only chiropractor left in the clinic, and all of a sudden I got a bunch of pregnant patients that came on my schedule. And at first, being new to practice, not having as much confidence, practicing and treating, and I hadn't seen too many pregnancy cases. I got some treatments at school, but I wasn't super amazing at it. So anyways, the first 8, 9, 10 pregnant patients I saw, I remember I was so nervous and I couldn't even treat properly because I was like, oh, maybe the bodies are more delicate and they can't handle the stress or the load or adjustments, or what if I hurt the baby or the mom, or all that above and beyond, right? So I was very gentle, very mild, but treatment was good, but maybe not as good as what you've seen in some of my videos right now. So I remember one incident where one patient comes in, and I think she was 36 weeks or 37 weeks pregnant, mid-30s, very open, very communicative, and a very blunt patient of mine, for lack of a better word. And I remember exactly, she comes into the clinic, she's just like belly over ears, walking in like this. It's like, Sarush, I can't walk at all, right? So I'm just holding her back and like sitting down. And so I get her on the table, and I have the same exact table here. Start treating her, and into the treatment, she's like, you gotta go a little bit stronger on me. I'm like, oh, you're 36 or 37 weeks pregnant, She's like, don't worry about it. I remember this exact sentence, I never forget it. She's like, honey, she called me honey for some reason. I think I was quite a young doctor, had a baby face. Anyway, she called me and it's like, honey, just go for it. Don't worry about it. I'm not fragile. Everything's gonna be fine. Just go for that big adjustment. So I've done all the soft tissue therapy work on anything. It's about stretches, anything that you could think about. So I got on her side posture, and she's like, you know what, go for it. Okay, fine. So at this time, there's a pool of sweat in the back of my shirt. I'm sweating, I'm like nervous. And, but I went 100%, did a proper adjustment, made a loud, super loud noise, right? And it just like released. We both looked at each other, we were in shock. Like, what happened? She's like, yes, that's exactly what I needed. Obviously, I'd released all the soft tissues, all the muscles, but it's exactly what she wanted. And she stood up quite a bit better. She moves like, that released it. Now, I could walk, and thanked me. And that was the moment that actually, after that, I was not afraid anymore to treat pregnant patients. I was like, pregnant patient is fine. We have to modify treatments. For the most part, they're not fragile, but it was a very interesting case. He got those jitters out of my, my hands, and being afraid or being apprehensive about it. And this patient, I never forget. She opened that door that was kind of like locked in my brain, and ever since then, I've been treating a lot of patients. She referred a ton of people to me, and since then, in 13 years, I get a bunch of pregnant patients coming in all the time. And yeah, we, obviously we modify, we assess, but we treat them properly and get the full dosage of treatment that they need.